Lillian Wald was the founder of American Community Nursing. She created the Henry Street Settlement to bring nursing care to underserved immigrants. As a nurse who works with underserved communities, I am inspired by her commitment to providing equitable and fair health care for all. Being a nurse means to me following in my grandmother's footsteps. That's the reason I chose to go into nursing. So nursing to me means, having a career where you really do make a difference, as cliche as that sounds. For me specifically, being a nurse means helping people, particularly marginalized populations. That's always been my love and my focus. So the one story that definitely stands out the most is calling this one patient. Not only did she have cancer, but I had to tell her she had COVID. I think she had realized she had COVID when she came in, and that wasn't a shock to her. But what I wasn't prepared for was the questions that she asked me afterwards. Like, what am I supposed to do for food? What am I supposed to tell the people that I live with? She was renting a room. And then just following up with her and realizing the diagnosis is just one thing, but how people cope with that, getting the food, getting their medications, how are they getting to their doctor? And this is a person, like when she told her roommates that she had COVID, they had asked her to leave. So where was she gonna go? That was the challenge, and definitely a story that sticks out in my mind. The rewarding part of dealing with the pandemic was when we had the vaccine. They were looking for volunteers to actually administer the vaccine. So as a faculty member here, being able to put together training for our students, the community, they were happy to get the vaccine. The students were happy to be, on the front lines administering the vaccine. And for me as an educator, it's always a great moment when you can see your students out there, working as a nurse and being so proud of them. That was definitely the most rewarding part of it. I decided to get the vaccine as soon as I could, the first day that I volunteered. So I was able to get it the first day, which was January 7th. I'll never forget it. I didn't really have any qualms about the vaccine. And I understand people's hesitancy with the vaccine, but I believe in our medical system. I believed in the vaccine. I did my own research about the vaccine. So I trusted it. And I saw the other side of COVID-19. So I know that I did not want to have the disease. My aunt, my mother, my grandmother, they were all worried about me when I was on the front line. I decided to get the vaccine because COVID-19 caused a lot of anxiety for me. I knew that I was exposing myself possibly to the virus every day that I was volunteering. Being able to have that vaccine meant that when I got on the subway, I didn't have to sit there and fear that the person who coughed next to me possibly had COVID and now I was going to get it. Because life didn't stop because of COVID-19. I wanted to see my family. I was around other people. I wanted to make sure that I didn't possibly spread the virus to others. So those are the reasons why I chose to get the COVID-19 vaccine. I think it's important to first find out where that person is and what their thoughts are about the vaccine. And I think the wrong approach is trying to shove it down somebody's throat and just, telling people they should just get it just because. And if you identify what the concerns are, then you can address those concerns specifically. So I think the first thing is addressing the concerns and then just providing them with the knowledge.